Namaskar. Good evening. Thank you so much for having me at this session. I really see that you are doing a commendable job for all these seniors. So what is constipation? No urge to pass motion is a constipation. Incompleteness is constipation. A hard rocky stool is constipation. And you need to do some maneuvers to pull out or push out the stools. That is also called constipation. So depending on all these things, we need to figure out how to treat it. Now, as I told you, every day we have trained ourselves that we have to have a motion. If you have a good motion, we are happy. If you don't have a good motion, then you are sad. Very clear-cut formula of life. What are the contributory factors? Age, diet, sedentary lifestyle, water intake, all the vices, good and bad habits, and the different postures, whatever we say. So what are the causes of constipation? We need to find out where the cause is located. Is it in the intestine? Is it in the rectum? Or is it at the anus? So depending on that, we have to treat constipation. Plus, all these patients have what is called as an iceberg phenomenon. They have anxiety, depression, insomnia, and a lot of psychological issues. That also needs to be addressed. Not only a physical constipation has to be sorted out. Who will do all these things? Well, here we are colorectal surgeons who are doing this dirty job. Then many people have a very lax, loose body structure, a very pouting like anus, and they have a hard stool where the liquid stools keep on seeping outside from apart from that liquid stool, and they always have to wear diapers. They are not having loose motion. Actually, it's a hard motion, and soft stools are just trickling from the sides of this hard stool. These are called spurious diarrhea. But who will diagnose all these things? There has to be some person who will diagnose them. Who is a specialist? And how do we evaluate? We have a host amount of investigative methods like anorectal manometry, MRI during the act of defecation, colonoscopy, and colonic transit time. We come to know how long does it take for the food to travel through the intestine. So friends, senior colleagues, if I may say so, it is a scientific approach. It is a proper medical approach rather than just going haywire and trying to grab some form of treatment for constipation and piles. Do you really want to play with your own health and body, especially at this stage? I would urge not to. Go to a specialist, proper person who has put his decades of life in only treating these issues. What happens? If constipation is not treated, we get piles, fissures, fistulas, prolapse, and yes, even cancers of the colon can be aggravated just by constipation. The piles, as we already have explained, the blood vessels swell up and they start bleeding and popping out. Fissure is nothing but a crack or a tear in the anus, and that is giving rise to severe amount of pain, like burning, poking sensation, which lasts for a few minutes to sometimes a few hours actually, even after passing motion. And if there is a crack in the wall, all the bacteria, see 30% of our stools, 30% of the weight of our stools is bacteria. But we do not get infection out of that. We get infection only when the inner wall is breached. There is a tear. So the bacteria, instead of going out, they form a hiding space outside the wall, and there they grow and they form pus. And when they comes out, that is called the fistula. What do people do? The senior most Dr. Google. They will just go on Google. And what will Dr. Google say? You have cancer. And what will the patient say? Oh my goodness. Do you really want to go through all these issues? The answer is
subscribe now and press the bell icon. Never miss an update.